Let us study about the different types of hemorrhage in this video. There are usually 5 classifications on which we study this. First is based on visibility. Here you have external, in which the hemorrhage is revealed. Then you have internal, in which the hemorrhage is concealed. And then you have a third category in which initially the hemorrhage is concealed, but later on it is revealed. So if you've written this, we can see the examples when this kind of hemorrhages are seen. Now in case of initially concealed, later revealed, you have melena. In case of internal hemorrhage, you have liver rupture or splenic trauma. And in case of external hemorrhage, which is the easiest, where you can see the hemorrhage of the blood coming out, that is active blood, active bleeding from any wound. Next category is based on source. So this site of hemorrhage can be arterial, it can be venous. If the bleeding is occurring from an artery, the blood will be bright red and pulsatile. And if the blood is coming from the veins, it will be dark red and continuous. Whereas if the blood is coming from the capillaries, it will be bright red and rapid. The third category of hemorrhage is based on duration. So it can be acute, it can be chronic, and it can be acute on chronic. Let us see the examples. So if you have faced a trauma, then obviously the bleeding will be acute in nature. Or in case of surgery, जिस समय surgery हो रहा है, उसी समय bleeding होता है. So acute. In chronic, there can be some underlying pathology. And acute on chronic example would be, there is a sudden acute bleed in a patient who is already having a chronic disease. Okay? Next, we can move on to the fourth category on the type of hemorrhage, that is based on onset. This is primary, this is reactionary, and this is secondary. I've written it wrongly here, but later on I'll correct it. So primary is the hemorrhage which is occurring at the time of surgery. Reactionary hemorrhage is occurring within 24 hours of surgery. This can be due to ligature slippage. So during surgery, you have ligated an artery. Maybe that ligature has slipped off, and then you can see the hemorrhage. And third category, based on onset, is secondary, which will occur 7 to 14 days after the surgery. Now I know the slide has become very haphazard, but I hope if you are following me while I was saying, you were able to write it down. Now lastly, we move on to the fifth category of the type of hemorrhage, that is based on intervention. This can be surgical and this can be non-surgical. This is all about the different types of hemorrhage. And please subscribe to the channel.